It really has been an exciting time hearing from all of the sort of PEPFAR partners. And I think I have, and I think others, I suspect others have been jotting down little notes about what we'd like to come back as a group and talk more about over the coming months, and what we'd like to emulate, and the spirit of bidirectional learning that Jen and I talked about up front, I think is on full display. So we do have one really last important, very important and last leg of this race we're on today, which is, that's already been alluded to, which is the level of effort, the complexity of the system makes me wonder about how this will be sustained. And I think what we'll hear is that there's a US government piece of this, but there's also an in-country piece of this idea towards programmatic sustainability. And we're really just so fortunate to close today with Michael Ruffner talking to us. Michael is the Deputy Coordinator for Financial and Programmatic Sustainability in OGAC and at the Department of State, and is really working with partner countries, including their finance ministries, to think about how to develop resilient and financially secure health systems. So it's such a critical piece, and Michael brings experience in the U.S. Department of the Treasury, Department of State, and was leading a team providing capacity building assistance to finance ministries, central banks, revenue authorities. So, perfectly suited to lead this work. Mr. Ruffner also held positions at OECD in Paris, the Senate Agricultural Committee, and the U.S. Senate Budget Committee, and was a presidential management intern at OMB. So I could say more, but we're tight on time. So Michael, thank you so much. And we're going to turn our attention to planning for the future. Michael is going to present, and then we'll hopefully have some time for discussion. Michael, over to you, and thanks for being here.
Thank you so much. So Becky and our interagency colleagues have talked about our successes, and those successes have really enabled us to look confidently to a different future. One where the epidemic is still ongoing, but it's manageable. And it also includes a future that is more driven and managed by our country partners. Next slide. But even within that confidence, we have to be sober and realistic about our challenges. So we've already talked about our common challenges going forward of constrained fiscal environment. We still have very little experience with long-term treatment. We have continued equity challenges. And a lot of these challenges aren't necessarily going to get better, and some of them may actually become worse over time. So we have to bear all of those in mind as we go forward, much in the same way that the domestic response is. Next slide, please. I want to take just a quick step back. Yeah, just click through. I didn't realize it was. So I wanted to take a quick step back. I think one of the underappreciated aspects is there are a lot of additional benefits of a PEPFAR, which is nominally a vertical disease program. And so, the PEPFAR program confronted a pandemic of an infectious disease, and we created a pandemic response. And that pandemic response has enabled other diseases. And we saw that first with Ebola and other pieces, and clearly in COVID with that. And there are a lot of other things that we've done. We had effects, we had economic effects. We had effects in education because we had less orphans and more kids going to school. We had effects in immunization. The reason I say that is that we're going to be making decisions for HIV reasons, specific reasons, that may have some knock-on effects to some other things. It doesn't mean that we shouldn't be making those changes for HIV, but we have to be sensitive to some of the other things that we've done. But we also have to take the opportunity, particularly in the global health world, to confidently think about the types of investments we can make for HIV that really support the global health architecture. And again, it's really one of the reasons and learnings about why we created the Global Health Security and Diplomacy Bureau here at the State Department. At the same time, next slide, please. We've been very focused on the 95s, and it's gotten to us a great place. We are at epidemic control in a number of countries and on the cusp of the other. But if we're there, we're just there. And we have very little experience staying there. And at a time, too, when in many ways demographics were a bit on our side. And now we're looking at a significant youth bulge. And it's just one of those additional threats that we have to do. And so we have to consider that by the end of the 21st century, half of the world's children will be in Africa. And a third of countries will actually have half of their population as children. And next slide. And we see that really starkly here. This is Uganda, starkly here in Uganda. And it's one of the reasons why the ambassador emphasized that we have to continue to accelerate. We have to continue to drive down incidents today so that we can deal with some of these very stark population pyramids that we're seeing. Next slide. And of course, it's not just the youth bulge. We know what conflict has done in Haiti, Ethiopia, and Ukraine. We know what happens when a hurricane hits Mozambique and Malawi. And of course, we saw what happened with other disease threats. Next slide. And a lot of these crises exacerbate the inequities. And in turn, those inequities exacerbate crises. So it's another reason why sort of globally we need to be thinking not just about equity in HIV, but a wider point about health equity that I'll come back to. Next slide, please. So we are starting in a very intentional way from moving from that emergency response to the sustained response. In many ways, we've actually already transitioned from that emergency response. We built the infrastructure in which we could scale. And so there are a lot of things that we needed to do to build those systems to scale that we have to start to wind off on. But at the same time, we still have millions of people on treatment. We still have incident infections. We have lots of other things that we have to do to prevent infections, especially in the face of that youth bulge. And so we have to make sure that any sustained response addresses those inequities and puts people first. Next slide, please. As I said, to date, we've had a very clear goal. The program knew what to do, and it was scale, scale, scale to achieve the 95s. And so at this point, we're having to shift. We've entered a period, a time of change where PEPFAR won't necessarily have the control it did in getting to that point. And so the ambassador has been very clear about being bold, as he says, to move us from this emergency scaling response to one that is sustained and long-term sustainable. And embedded within country systems. Next slide, please. So we necessarily focus on governments, but we really have to start with and rely on the communities. I think it was Mark Dybul who said that we started with communities. They were there before the governments, before PEPFAR. They brought us to this point, and they really are central to a sustained future. And so we have to put them at the center of our sustainability response. Next slide. So as was noted at the outset, I came from the Treasury, and a lot of it was to understand to understand what we had to do with finance ministries. But it's not all about the money. In fact, in many ways, it's real, but it's not all that has to be there. The ambassador came in and noted that, HIV just wasn't talked about in presidencies. It wasn't talked about in finance ministries. And in many ways, it wasn't really even talked about in ministries of health. And so we need that political commitment, not only to achieve the 2030 goals, but making sure in the absence of occur that we maintain those gains in the future. And we also have to be courageous in shifting around the programming and really ensure in the future that that there's an equitable response sustained in the future. Next slide. I just wanted to highlight that UNAIDS just published a really new, very interesting study looking at equity. So we know about the inequities in the HIV response, but as we look to the future, there are other sorts of equities. One of the conclusions of the report, of which Jen Cates was a main author, was that the HIV response was actually more equitable than the national health system. And so we're now thinking about putting that HIV response firmly into those systems. And so we're going to have new inequities that we're going to have to be mindful of in this sustained state. Next slide, please. And so it just makes the point that equity is not some sort of initiative. That is something that just has to be embedded in what we do. Next slide, please. So the ambassador is very clear. This is not a PEPFAR sustainability roadmap that we have to develop. It's an HIV sustainability roadmap. And to that end, it is properly the role of UNAIDS, which is a joint program that collaborates with the other UN agencies, notably, WHO and UNICEF, that it is their job to put together the idea of what you need for a sustained future. And so the task for the PEPFAR program is to take these ideas and clear goals of what the HIV response will look for the future, and put that into our COP planning in the future. For those that have followed PEPFAR, know that this is not the first time that we've been down this road. We've had partnership frameworks. Sustainability first showed up in our authorizing legislation in 2008. And one of the factors is that we never really embedded it firmly in our program. And so that's what we're going to do. Next slide, please. Now, I also want to be clear that sustainability doesn't mean cut and run. However, the ambassador is clear that a truly sustainable response is one that is embedded, run run by countries, and not with a heavy donor hand. And that means that we have to have an intentional process of transitioning elements of the response over to governments and domestic entities. And he has now put down a goal that a large majority of HIV prevention, care, and treatment programs are going to be led and delivered by governments. And we are now in the midst of trying to figure out how to make that a reality. But I want to underscore that he talks about a responsible transition. He wants to ensure that this future state goal is done in a responsible way. And then it entails understanding those threats. It entails shoring up weak and underfunded systems and making the case. And above all, it's about ensuring equity. And so that we're going to be a partner along with those communities, along with our with the multilateral partners, and along with the governments themselves in advancing that goal. So just two quick slides, next slide to end up with. I just want to talk a little bit about how we're going to approach this. We talked about the COP before, about how we're going to do this and how we're going to balance the sustaining and the accelerating. And a lot of that is thinking about how we how we simplify the program. We've talked about the complexity of what we needed to do when it was an emergency, when there weren't systems and institutions and processes in place. And we now need to wind that back, but also realizing that every country is going to have a unique approach. There are all sorts of different country contexts that we have to go there. And we need to be driving towards a new program. We can't simply just hand over what we've done to date. We have to be thinking about how this will be bedded in the future. And so next slide, I'll just end with this. What will we know? How will we know that we've succeeded by that point? Well, we'll have reached the 95s, and in many cases, we will have gone beyond that. We will have experience in keeping viral suppression down or viral suppression up. We'll have reduced new infections again to deal with those youth bulges, and we'll have had success in reducing those equity gaps. And most importantly, that's going to be done with greater partner government responsibility and accountability over the HIV response. And that is the driving force for what we're going to be doing over the next couple of years. So with that, I thank you all and happy to answer a lot of questions. And I would note that Becky is also on the line and will also be available to answer questions.
Wonderful, thank you. So we'll open this up now for questions for Michael and Becky, but that was a fantastic forward-looking, and it makes me feel like there's still a lot of work to be done. So thank you for that forward look, and we'll kick things off with Paul. Oh, you're on mute.
I'm sorry, muted. So, Michael, thank you for that presentation. One of the things that was very striking to me was you talked about making a decision or an understanding that you had to hand off responsibility to the countries to take the lead in running their programs. And, you know, obviously for me, that becomes a really interesting discussion when you look at the domestic response and kind of who controls what and who has the ultimate say for what. And so how did you get to that place, and how did you get to the comfort level of letting go of control? Because, you know, that's a huge piece of that discussion.
Fascinating question. We actually haven't gotten there, really, to be honest. I mean, we're just at the cusp of these discussions. You know, we've known for a long time, we've been talking about the need in vague terms about countries taking on financial and programmatic responsibility. But now we're going to be much more forward-leaning and intentional about it. I mean, so we don't know. You know, we came in. We needed to take control. The U.S. came in with a very heavy presence in many respects because there were only really modest systems and very little understanding of that. And so that's going to be, we have many, many challenges to balance. And one of those is, how do we give up control? Now, the reality is that we still need donor assistance. There are some countries that financially just don't have the wherewithal and will need long-term supports. There are other places where we have to be honest that the political will is not there for a complete response. And there are some things that donors can just do more efficiently. So again, that's the point, is like this balancing piece about what we do, how we hand over, how we accept that things aren't going to necessarily be done the way that we did them or we want them, and then trying to figure out what then PEPFAR's role going forward. So it's a fascinating dilemma, and again, this is where we need to be thinking back and forth between our domestic and our global response and learning together as we confront these common challenges.
Thank you. Jesse.
Thanks so much. First of all, I'm on the global committee, but I just have to say, Jen, you and Patrick did a magnificent job pulling today together. It was truly a home run, and the agency leads that participated gave us an encyclo that PACHA has needed. So my question is for Becky, if she's still on the line, and also for Michael. Two parts. We've talked a lot about sustainability for country responses, but we haven't talked about funding sustainability from the US and what that means, particularly in this political environment. And the second part of that question is we, both the Global Committee and all of PACHA, I think, has been struggling what role we have for PEPFAR. And so my question really is, Becky, how can PACHA be helpful for you as we are doing our work advising the secretary, then of course also as necessary supporting the White House in its efforts, but mostly the secretary? Can we be helpful, and what would your request be of us?
Jesse,
may I just add to Jesse's question, just because
sure, please.
the piece that is attached to that. I just was curious as far as the sustainability planning is concerned as well. Given that reauthorization of PEPFAR was more difficult this year, like what does that sustainability planning kind of look like from a financial perspective? So I just wanted to add that. Thank you.
No, great questions. And can you hear me okay?
Yes, we can.
Yes, okay. If I break up, Mike, I'll have you jump in. But I mean, great questions, and really appreciate, Jesse, the spirit of the question, because we are extremely grateful for PACHA membership support in our needs to get reauthorization, to get future funding. So I think, this is something we need to follow up probably with Patrick and Jen and the committee, and maybe share some materials around our strategy around this. As you can imagine, we have different strategies for different scenarios, depending on how things unfold for our nation in the next couple months, in terms of political leadership. But I think, right now what we're focused on is really education. So bringing awareness to what PEPFAR has done. Many members of Congress, for example, don't really know anything about PEPFAR. They hadn't heard about it. They didn't have Mark Dybel's wonderful talk that we all heard this afternoon. So I think your ability to sort of share the story and the importance of it, and the importance of us scripting the next chapter in a meaningful way would be very helpful. In terms of the Lee's question, I think about the economics. Mike can jump in more specifically on the finance part, but it costs in this new fiscal environment that there could be more constrained budgets. So looking for those efficiencies, looking for ways we can leverage things like lenacapavir, like integration into systems that may be less costly than some of the models we've used in the past, are all going to be important. Sorry, I think I just muted myself. Yeah. Mike, do you want to jump in a little bit more on the fiscal side?
Yeah, I mean, look, we're also going into a unknown period, right? I like to tell people that sustainability and transition is not a cost-free proposition, right? We have investments that we have to make. As I said, if we're going to be putting these, the HIV response out of these standalone systems into the underlying systems, and we have all of these challenges, equity, weak systems underfunding, that there is a role for us to be building those systems up. And so there are things that we can do to become more efficient But it's not like, I mean, a lot of people look at it and say, well, hey, congratulations, you hit your treatment goal. But that's only part of the equation. Getting the people to understand that, and understanding that there are these other investments that we have to make, and that there are some areas that we haven't had to work in before that we may have to address. So we exactly what that is, you know, it's very hard to say what that is. It's very hard to understand like I have difficulty, for example, telling the finance minister exactly what they need to put in their budget if it's being integrated into their systems. But it's a real cost, and the things that PEPFAR has to do in that responsible transition is again not cost free.
Yeah, I mean, I think it's really important and incumbent for all of us, Jeff, Susie, everybody, to be very clear that we have no cure, we have no vaccine. While we've got some very powerful tools, this cannot be over. And the successes we've made domestically, internationally, everywhere, are fragile. And when we're in a world where if we interrupt antiretroviral treatment, you know, within a matter of a few months at best, weeks at worst, one's viral load, if I'm on ART, my viral load's going to go right back up, and I will get sick. I will transmit. You know, we will spiral backwards very quickly. So that is something that I think we need to make sure is understood by a generation of leaders who really weren't exposed to the horrific images that Mark described at the beginning of this session.
So I'll ask one last question, which might bring us to time, but sort of in the discussions with country government, are economic, you know, models or arguments persuasive? I think part of what Dr. Bunnell's raising is it may be cost saving to discontinue medications for a cohort of people, but there's going to be a lot of downstream costs incurred. So I just wonder, sort of, are there other kinds of evidence that could be developed by researchers or using existing tools that you feel like would be persuasive? So is it really just sort of a human cost argument, or like what are the elements of persuasion around avoiding the scenario that Dr. Bunnell's talking about? And are there other things that this group could network, support, talk up, encourage, you know, that would be helpful tools?
I mean, so I know Becky probably has her ideas. I'll just kick off. Coming up with just classic economic arguments is very, very difficult at this point. Again, it's not that, I mean, we showed that there were economic benefits from having it, but things would have to go really off the rails to get back to a situation where it's a classic economic case. We're also at a time we have to be realistic about what your average finance minister is looking at, right? They're looking at that youth bulge, not only just, I mean, they're not even looking at it as the HIV threat. They're looking at it as a security threat that they need to have they all need to have jobs. And so they have a lot of other things that they have to invest in. And so, you know, there are lots of things we can do talking about, you know, it's not just about HIV. That's partially why we started doing the spillover benefit work. It's that there are other health gains that can come out of it. We can prove through the pandemic, but those are all, you know, they're very difficult arguments in a place where money's constrained, and there are better economic arguments to put their dollars. And again, another reason why I think that we need to sensitize people that there's going to need to be a long-term donor response. We talk about the levels, we talk about what elements of the response are, but it's not, we can't just hand it over in every single country. I don't know, Becky.
Yeah, I mean, I think the variety across countries is clear. If, you know, a country like Angola, it's one might be able to self-finance, but a country like Malawi, it's not possible. But as Mike showed, those three elements of sustainability, I think we're really focusing on making sure that all countries have the programmatic capabilities to run their own programs and the political will and policy environment for those programs to be successful. It's, you know, for some low income countries, it's not feasible to imagine that they're going to completely self-finance. So that's part of our education to Congress, I think, is that there's going to be a range. We're working to show that we are on a glide path to the future that makes sense given the constraints where we are. And again, we really appreciate joining forces with the PACHA community around that.
Thank you. I am going to note that I'm 2 minutes late and hand things over to our wonderful PACHA chair, Marlene, for your next steps and closing remarks. Sorry, I cut into your time.
Not at all. I hope PACHA members and everyone will join me in giving a very resounding round of applause to both Drs. Jen Cates and Patrick Sullivan. Today has been extraordinary. It has been absolutely responsive to what the council has asked for and wanted to learn more about, and really in our humility come with an eager, learned, and expectant mind about how we might apply some of these lessons here domestically. So thank you, thank you, thank you. I can't say enough. And really just wanted to encourage everyone to join us as we resume tomorrow. We do, for PACHA members, have a full day. We've got several resolutions to comb through, in addition to the exciting panel discussions we have lined up for tomorrow. Certainly continuing on a little bit of this domestic global conversation, specifically with U equals U. And then, of course, we are proud that we represent and push the voices of people living with HIV, those vulnerable to HIV, into our recommendations in the work that we do around this council table. So looking forward to hearing more from constituents around the country, both during PACHA-to-the-People as well as during public comment. We have made space on the agenda to do that. So I am excited for today. I am excitedly expectant for tomorrow, and just really want to thank Caroline, Talev, all the staff at OIDP, and those who help to support our virtual environment and make sure that people can access some of these important conversations as well. Rosalie and Associates, HHS Studios, thank you all for the work that you do. And so for today, we will recess and we'll join again tomorrow at 1 p.m. Eastern Time. Thank you again, everyone.
Produced by the U.S. Department of Health and Human Services.